Senator Casey.
Thank you, Chair Murray. I want to start with Dr. Walensky. Doctor, as you know, the CDC has been working with my staff on an outstanding nursing home vaccine data request. I would appreciate it if you and your team would continue to work with me and with our team at the Aging Committee to resolve this matter.
Yes, thank you, Senator. I'm aware of that matter, and we are committed to continuing to that work with you. Thank you.
Thank you. Let me turn to a matter for Health and Human Services. Assistant Secretary O'Connell, you know that our nation's long-term care facilities were ground zero during the first year of COVID-19. 200,000 residents and workers, when we add up the number of residents plus the number of workers who died, it gets to 200,000 over these 2 years. However, nursing home deaths have declined dramatically thanks to the safety and effectiveness of the vaccines. It's a credit to the administration that 90% of nursing home residents and 80% of workers have been vaccinated. We know that infections are on the rise right now, though, in nursing homes, raising safety concerns and putting additional pressures on workers who have been stretched thin. For instance, we know the pandemic has worsened existing staffing shortages and turnover issues. So we also know at the same time that the rescue plan that Democrats passed in March helps to fill the staffing gap with a $500 million initiative for strike teams based upon legislation that I was leading recently. These strike teams provide medical personnel and other supports that help nursing homes get through the surges like the one that we're seeing right now. On the 22nd of December of last year, I, along with 3 of my colleagues, sent a letter to Secretary Becerra asking how Health and Human Services was protecting nursing home residents and workers in the current COVID-19 surge, including the distribution of booster shots. What is HHS doing to ensure nursing homes have the supports they need to protect residents and workers who care for those residents?
Senator Casey, thank you so much for your question. We share your concern for nursing home staff and long-term care facility residents and have continued to do all we can to make sure they have access to boosts. We've worked with the pharmacies to bring in vaccination clinics, bring those to the long-term care facilities and skilled nursing facilities. So the vaccines are available on the ground and the residents don't have to travel or access the vaccines on their own. In addition, ASPR has been sending since the beginning of the pandemic, or since the beginning that these tests were available, 2.8 million tests per week to long-term care facilities across the country. We know how important it is that they're able to surveil any disease in their facilities, and having access to these tests is one of the ways they can stay on top of where they are. So we share your concern, and we'll look forward to responding to your letter.
Thanks very much.
Senator Burr.
Thank you, Madam Chairman. Ms. Woodcock, I know you said